Breast cancer is something that hits close to home for Terry Bergeline. Both her grandma and aunt died from the disease.
My grandma Twyla, my mom's mother, she passed away from breast cancer when I was 4 years old. And then my Aunt Cheryl, my mom's sister, she's like a second mom to my sisters and I, but she was diagnosed in 1992. And she fought cancer for 19 years and ultimately passed in 2011.
That's why breast cancer is something she also takes seriously when it comes to her health.
With our family history, there's just been sort of a thread of knowing that we're at higher risk and that, breast cancer is a part of our story. And so when I started my 20s, going to my, well woman checks and things, we started having those conversations about family history.
After finding a lump in her breast in 2019, she was referred to the high-risk breast cancer clinic. After a breast biopsy, it was determined to be benign.
I was nervous, but I knew that whatever it was, that I had a care team and people to follow and take care of me.
The high-risk breast cancer clinic is a resource people can use to maintain breast health and know their risk when it comes to cancer.
When a patient is referred to us, we look at their risk factors for breast cancer and we put that information into a computerized risk model. And that risk model determines if they meet criteria to do additional surveillance based on their calculation. So anybody that calculates greater than 20% is considered at elevated risk.
Prevention tips are also something providers offer to keep their patients informed.
We can't take away the fact that they're female and that they're getting older or their family history or genetic makeup, but can we help them reduce their risk by encouraging exercising and weight management and eating a well-balanced diet and avoiding smoking and avoiding alcohol and all of those other environmental things that are linked to breast cancer.
Redmond says the earlier breast cancer is found, the better.
You have great screening tools for breast cancer and very helpful to use them to find something early. If we catch a breast cancer at stage 0 or stage 1 diagnosis, it's a much shorter treatment course for the person, but it's more, I always tell people, it's more of a bump in the road instead of a roadblock.
Now Bergeline continues to share her story to encourage others to understand their risk for breast cancer.
Be open about having the conversation. I don't think anyone should be, with a family history, should feel nervous about entering the high-risk breast clinic because it's really a more proactive approach in your own health and how you can get people on your team. There's enough risk factors in the world. Let's try and take care of what we can take care of by integrating with the technology here at the Vera Cancer Institute.